Good morning, everyone, and welcome to this Across the Aisle webinar hosted by the Women's Initiatives program here at SIPA's Institute of Global Politics. The whole Across the Aisle series was made possible by the generous support from the Knight Foundation. And I am Karen Yarhimilo. I am the Dean of the School of International and Public Affairs and the Adlai E. Stevenson Professor of International Relations. Now, the missions of IGP's Women's Initiative, as you know, is to drive progress on policies that are critical for the full and equal participation of women in society. And for that, paid leave is not just important, it's essential. Now, sadly, the United States is a global outlier in this area. Although 13 states and the District of Columbia have passed paid family and medical leave laws, the United States is the only OECD country and one of only 6 nations in the world without nationally guaranteed paid leave. Now, despite these dismal statistics, I am happy to say that there is hope on the horizon, and in no small part to the work of the Congressional Bipartisan Bicameral Paid Leave Working Group. And I am absolutely delighted that its 2 co-chairs, Senator Kirsten Gillibrand and Senator Bill Cassidy, are joining us today on this webinar to discuss their progress. Now, before I formally introduce our speakers, I would like to turn to Therese Coudreau-Curiel, the Knight Foundation's Vice President of Administration and the Secretary of the Board of Directors. The Knight Foundation, as I said, is really the reason we have the Across the Aisle series in this Institute of Global Politics. And since the launch of the IGP last fall, this has become one of our signature event series, bringing together leaders with opposing viewpoints to model to our students, to our community, the value, the importance of civil discourse, which is really an essential part of identifying bipartisan solutions to our toughest policy challenges. And as you know, today more than ever, we need to model to everyone how this looks like. And Therese, the floor is yours, and thank you again for your support.
Thank you, Dean Yarhimilo. So at Knight Foundation, we believe the First Amendment right to free expression is critical to a thriving and participatory democracy. Yet in this age of deteriorated civil discourse, exercising the right to say what you believe is often fraught with undesirable outcomes. Today, we need not just the willingness to exercise our right to say what we believe, but we need to learn or relearn that skill. Knight Foundation funded the Across the Aisle series at Columbia School of International and Public Affairs to model and promote constructive conversation between global leaders with disparate perspectives on an issue. This is one of 4 Across the Aisle discussions, and on behalf of the Foundation, I'm thankful to Dean Yarhimilo for her courage and her vision for creating this series and their care and in thoughtfulness in designing the space for these kinds of conversations.
I'm now unmuted. Thank you so much, Therese. And we will now kick off the program with a discussion between 2 members of our faculty, which will provide the historical and policy context on the status of paid leave today. And I'm thrilled that we have Professor Jane Waldfogel, is the Compton Foundation Centennial Professor for the Prevention of Children's and Youth Problems and the co-director of the Columbia Population Research Center at Columbia School of Social Work. And she is an authority on paid leave research, having authored several influential studies alongside Columbia Business School professor Ann Bartel. And Jane will be joined in conversation with Professor Sandy Black. Sandy is a professor of economics and of international public affairs here at SEPA and an IGP faculty advisory board. And her distinguished research focuses on the role of early life experiences on long-term outcomes, as well as the issues of gender and discrimination. Sandy served as a member of President Obama Council of Economic Advisors from 2015 to 2017. Now, following Jane and Sandy's brief background discussion, we will then be joined by Kirsten Gillibrand, the Democratic senator from New York, and Bill Cassidy, the Republican senator from Louisiana. Senator Gillibrand has been a champion of paid leave in Congress. She is the lead sponsor of the Family Act in the Senate, alongside Representative Rosa DeLauro at the House of Representatives, which would create a permanent national paid family and medical leave program and has been reintroduced in every Congress since 2013. I'm also very delighted to have with us as ranking member of the Senate Committee on Health, Education, Labor, and Pensions, Senator Cassidy, who has also been a champion for paid leave in Congress. And in 2019, he released the first bipartisan paid leave plan with Senator Kirsten Sinema, and would offer families more immediate access to the child tax credit following birth or adoption. And I am really delighted to have all these great, the great scholars and the senators with us to talk about these important issues. What we're doing now, or they're doing now together gives me hope. I hope it will give you hope. And with that, Jane, Sandy, the floor is yours. And thank you so much for everybody for joining us today.
Great. Well, I'm happy to be here with Jane to set the scene for what's been going on in terms of research and what we know about paid leave. So to get us started, Jane, why don't you talk about how the US compares to other countries in terms of the provision of paid leave?
Thank you, Sandy. Well, as we heard from the Dean, the United States definitely is an outlier when it comes to paid family leave. Usually we compare the United States to the other OECD countries, the wealthy nations in the world, of which there are 38. We are the only one of the OECD countries that doesn't offer paid leave to new mothers, one of only a few that doesn't offer paid leave to new fathers. Our peer countries also typically provide paid sick leave, paid disability leave if you have a longer term illness or injury, and also leave to care for seriously ill family members. In contrast, our federal law, the Family and Medical Leave Act of 1993, provides only unpaid leave, and even worse, it only covers only half the workforce. So half of employees are left out, and 2/3 of lower wage employees are left out. Now, often we assume, well, that's not so bad because private employers will provide paid leave coverage, but of course that's not the case. Nearly 3/4 of private sector workers don't have any paid leave that they could use to bond with a new child or to care for a seriously ill family member, and over half don't have any short-term disability coverage to care for an illness or an injury that goes beyond the period of sick leave.
So it's striking to me too when you talk about this and when you hear about it that it's not even just the OECD countries, right?
Oh,
it's
no.
not just the rich countries that were
No.
behind. It's
no. No, often the statistic I hear is that we're one of only 2 countries in the world that doesn't provide paid family leave, the other one being Papua New Guinea. But I know often people sometimes will say that's comparing apples to oranges. We really ought to compare ourselves just to the more wealthy nations. But even in that group, we're an outlier.
right, exactly. So given that the federal government hasn't done anything, what have the states been doing? So some states have kind of taken it on themselves. So what have they done?
The states have been incredibly active. So starting in 2004 with California, 13 states thus far in the District of Columbia have enacted state paid and family and medical leave. that provide, leave to care for a new child, your own illness, caring for a seriously ill family member. And all but one of those, except for New York, uses a social insurance model. So that's a model where employees and employers pay a small amount in per week, the same way that you would for Social Security or Medicare. And that goes into a social insurance pool. And then when an employee goes out on leave, they're paid from that social insurance pool. It's a really important point because I think sometimes employers used to think that if we had a model of paid family leave, that would mean that an employer would have to pay for the leave when an employee is out. And that can be burdensome because often an employer has to pay for a replacement worker or they have to arrange for someone else to cover the work. And it's hard if you also have to pay for the employee being out. And of course, that's not how these models work. The way these models work is everyone contributes and it's social insurance. New York previously had a private insurance model because of their Temporary Disability Act. And so in New York, unusually, the leave coverage is through private insurance. And that's also a model that a number of other states are looking at in terms of voluntary coverage. So there's a lot of interest at the state level. And even among the states that have not yet passed laws, there's large majorities of voters who support these laws.
So can I ask, how would voluntary coverage work? What does that mean?
The voluntary programs allow private insurers to offer paid family leave coverage. And that was a product that didn't used to exist except in TDI states like New York. So that's a model where one can purchase private insurance and that would cover, typically those laws only cover maternity. So obviously I don't want to say, well, I was going to say a second best solution. Maybe they're like a third or a fourth best solution. But for completeness, that is something else that's happening at the state level.
So there's been, I know, a huge body of literature, much which you have contributed to, on the effects of paid leave on a whole host of things, right? Parents, kids. What do we know about the effects of paid leave?
Well, I mean, one of the good things about state laws, besides the fact that they provide a lot of coverage, is that they're a laboratory for research. So a lot of the early research we had was from other countries, and people understandably would say, oh, I don't know, that study's from Denmark, or it's from France, or it's from Germany. How applicable is that to the US case? Their periods of leave are so much longer. So now we have a lot of research just based on our own state laws. So what have we learned? First, we've learned that when there is paid leave, people take it up, and especially workers who are lower income and less advantaged, who were less likely to have employer coverage. And that's different from what we found with the FMLA, because the FMLA, unfortunately, was more used by more advantaged workers who could afford to take unpaid leave. The second thing we've learned is there's a lot of evidence about paid leave and improvements in maternal and child health. So this includes fewer low birth weight babies, more breastfeeding, more timely vaccinations, improved child health, reduced asthma and allergies, decreased infant hospitalizations, decreased infant deaths, better maternal mental health. And then when the children are followed up later on when they're in school, we find better overall health for the children, less overweight, less ADHD, fewer ear infections, and fewer hearing and communication problems. So it looks like the effects are not just confined to infancy, but there's some lasting benefits. Third, we also find generally beneficial effects on job continuity, employment, and earnings. Fourth, there's now a lot of research on employers. As the dean mentioned, I've done a lot of this work with, together with Ann Bartel at the business school, and Chris Room and Maya Rawson-Slater and Meredith Slocum. Early on, research not by us in California had found that employers, 90% said the law had had a positive or neutral effect on their operations. But we wanted to survey employers, more systematically. So we surveyed employers in Rhode Island, New York, New Jersey, and found that a large majority of employers were supportive of the state laws. Only a small share were opposed. And this was especially surprising and striking because the firms we surveyed were small and medium-sized, firms with fewer than 100 employees, who often are not surveyed, and where we might have thought that having to manage leave might be onerous. We also did a systematic comparison of New York when they turned on their law with Pennsylvania, who didn't have a law. And what we found when we compared post-law to pre-law was that there were no adverse effects of the law in New York. And in fact, we found positive effects when we asked employers to rate their employee commitment and cooperation, and also the ease of handling absences. We then went back to those same employers during COVID, when there was obviously a greatly increased need for leave and there were some special provisions in place. And we found that employer support for paid leave increased during COVID. And the employers who had actual experience of their employees using the policy were the most supportive. So all of this sort of gives you confidence that as employers have gotten used to these laws and actually experienced them, they're positive and they get more positive with use. And this was something that we did not know until recently.
So I think this is really interesting, and I just want to highlight, because as someone who's kind of taught paid leave and talked about it with my policy students and even, talked about it in the White House, one of the things that Jane points out is that for a long time, the only research we had was from Europe, right? Because the US didn't have any paid leave policy. And so it was really hard to kind of say, even though the evidence was very strong that paid leave was beneficial, a lot of the research from Europe was saying, if we extend it from 6 months to 10 months and not from 0 to something. And so I think people were skeptical about how effective it would be or what would happen in the US. So Jane, your work has been, I think, very influential in showing that in the US, there really are just all these positive benefits, and that the costs seem relatively low, and clearly the employers are happy with it. So given this, and I'm very curious what the answer to this is why don't we have paid leave?
Yeah, so that's such a good question. And I'm really glad that we have like the next 3 hours to address it, because like people have written books about, it's referred to as US exceptionalism, and it's not just in the area of paid leave, it's across all the different aspects of social policy. There's a host of historical reasons why we tend to be different from other countries. We have a more residual welfare state. We rely more on individuals, families, employers, communities, less on government. But I would say, just to say a couple of more optimistic things, other than that, well, that's just the way it is. One is that it's not so much that we never implement policies that other countries have. It's just that we're much slower to get there. So there's a whole host of areas of social policy where we were later to implement the policies, but we did eventually get there. And I think that'll be the case with paid leave as well. And then coming back to the issue of the states, we have more states, we have more state policies than any other country. And throughout our history, the states really have been laboratories for reform. And across a lot of policy areas, states innovate, states start introducing these policies, they learn from each other, each state policy becomes more evolved and better, and then eventually the federal government follows suit. So again, I'm absolutely hopeful that we will get there in the end, but more slowly than other countries.
I like that. I feel more hopeful from that. So we've been talking about mostly or focusing on parental leave, but there's really a whole bunch of different types of medical type leave. So can you talk a little bit about that?
Yeah, so actually the most common type of leave that people take under family and medical leave, whether it's paid or unpaid, is leave for their own illness. And that's actually where there's the least research. Families also use the leave to care for children who are ill or have an injury. And that includes, the 15% of families that have a child with a special health care need. So a chronic, ongoing serious illness or condition. So we do have a little bit of research on those families. And we know that when they have paid leave available, the parents are more likely to take leave. They're less financially stressed, and they report that their health and the children's health is better. Then we have a bunch of adults who are caring for disabled adults or older family members. There's probably more than 50 million Americans at any given time who are caring for a disabled adult or an older family member. This is only going to grow as the population ages. We have a little bit of research about that population, not as much as we'd like to have. We know that older workers who care for a disabled or seriously ill spouse, paid leave enables those workers to stay in employment longer rather than quitting their jobs altogether to provide care. We also know from one study in California that when they passed paid family leave, that led to an 11% reduction in nursing home use and also led to lower Medicaid expenditures. And so you can imagine often when somebody has an injury or, your mother falls and breaks her hip, where does the rehabilitation recuperation take place? It takes place often in a nursing home because there's no one to manage the care at home. Whereas if the daughter or the spouse is able to take some paid leave and manage the care, that person could be at home with home care rather than in a more expensive nursing home. So that's a hugely important area that we tend to neglect when we focus exclusively on parental leave.
And I think COVID really brought to light the importance of paid sick leave in terms of you want people to stay home when they're sick. You do not want them to have to go into work. You want them to be able to stay home and take care of themselves. So another thing about parental leave, we focus a lot on mothers taking time out for this, but where do fathers fit in?
Yeah, it's a really good question. And here, culture comes in and norms come in and gender roles. When the FMLA first passed, one of the biggest beneficiary groups of mandating that employers had to offer at least unpaid family leave if they were in large firms. One of the biggest groups that benefited were fathers, because it was much more common for employers to offer leave to cover maternity than it was to offer leave to cover paternity. So there was actually a big expansion in paternity leave coverage. And, fathers still don't take a lot of leave, but they will take it if it's offered to them, and especially if it's paid. And the states have done a really good job of trying to, reach out to fathers to make sure that they know that they're allowed to take these leave policies. I remember when New York's law passed, the subways were just plastered with posters showing fathers, pictures of fathers, and saying, now you're eligible for paid leave. And we do have some research on fathers. We know that when fathers take paternity leave, it leads to improved child and family well-being. We know that it actually improves mothers' postpartum physical and mental health. We know that fathers are more involved with children, and they have better relationships with their children and with the mother. And we also find some long-term improvements in children's school performance. So yeah, fathers are important.
It's interesting. I saw a study where they had parental leave. I believe it was in Norway, and they had leave for mothers and fathers, and the fathers just didn't seem to take it up. And then they showed that there's kind of, if your peers are taking it up, the fathers are more likely to do so. So it definitely seems like there's some cultural or social norms aspect of, getting fathers to participate in this and be involved.
There definitely is, and I'm always thrilled when I hear about whether it's a baseball player or a football player or a soccer player who's taking leave because that his family is having a new child, because that kind of role modeling is just really important. Yeah, and in a lot of the countries overseas, they started out, of course, with maternity leave. They've had that, for centuries, and they added, paternity leave later. And there's been issues in getting men to take the leave, and there's been talk about, reserving a quota of the leave for fathers, and they call it the daddy quota, to ensure that there's a portion of the leave that fathers take. We don't really have that situation in the States because we have individual entitlements to leave. So in a state where there's paid leave coverage, whether it's California, New York, or one of the total 13 states that offers it, fathers have the same kind of entitlement to bond with their new child as mothers do. And so both a mother and a father can take leave, whether they're taking it concurrently or they take it, back to back.
And I think, there's a lot of evidence both on leave and from other policies where we see that when parents spend more time with their kids in early childhood, there are going to be big beneficial effects for the children. So I think thinking about kind of both mothers and fathers and maybe how we can change social norms to make this kind of more common is important. So I think we're about done. Are there other thoughts you have, Jane, in terms of where your research is going next? Or
I think both the senators are, if the senators are here and ready to start, we can switch over. I just want to be sure that they're both here and ready. So maybe we can just check in. I see their names, but I don't know if they're here because we're a few minutes early. I don't see them joining. I know they were expecting to join in about 3 minutes. So with them not, I think we'll wait until we see that they're here. Yeah, I mean, I'll be curious to hear the senators' thoughts about research and what more the questions that they have. I think they did quite a systematic survey when they started their bipartisan working group. And so I know that they've been working really hard to gather research evidence, and I'll be really curious to hear what more they would like to hear, because I think it's evolving really quickly. When I first started doing work on employers and surveying employers, this is not the work that I normally do. I normally work on children and families, but I was hearing very consistently from people, we need work on employers. We really need to know how it is for employers, because that's the big area of concern. It's going to be onerous for employers, and especially the small employers. So we spent years designing and implementing a survey of small employers and fielding it and analyzing the data, and found that there were really no adverse effects on the employers. And it was so interesting because when we presented the results all over the country, people said to us, oh, we know that. We know it's not, it's not costly for employers. And it's like, oh my God, I'm really glad that we know that. Now we can move on and go back to studying other things.
I'm also really curious to hear from the senators, because when I teach this in my policy class, it's difficult because there are very few policies where I think both sides agree that this is, the evidence is clear that this is something that works and has these positive effects. And if you look at kind of both sides, there's a lot of support for this type of policy. I try to pick policies where I think there's going to be some good debate, and here there's not as much debate when both sides kind of support the federal paid leave. So I think, yeah, hopefully this is going to make things happen.
Yeah, well, it looks like Senator Cassidy is here, so we'll go ahead and switch over. And thank you, Sandy, for the great questions. And thank you so much, Senator Cassidy, for joining us today. It's so good of you to make the time, and thank you for your leadership on this issue. A lot of people are here at this.
Professor Black put a lot of pressure on us by saying it's just so few areas where there's bipartisan support for something that works so well. That must mean we got to get a result.
Excellent.
A lot of people have joined today, and they've joined because they're really excited to hear about the interest that there is in paid family leave on both sides of the aisle. And in particular about your work as you and Senator Gillibrand's work as co-chairs of the bipartisan bicameral paid leave working group. So we would love to hear from you about the working group and how's that going?
So we have 12 in the working group, 6 Republicans, 6 Democrats. Now 1 or 2 will leave after this next election, just they're phasing out. But nonetheless, the spectrum we have is from fiscal hawk all the way to the person who would be the opposite of a fiscal hawk. And so, so there is kind of that sort of, we are into it. We've got to find a solution. We've put out an RFI, if you will, to interest groups, to families, you name the stakeholder, and the RFI went out to them, and we've got 170 replies. So we're reviewing those replies. Oh, and I see my colleague on. So the key thing is, of course, how do you pay for it? And that's the rub. And there's different dials, and Senator Gillibrand can talk about the dials. And there's different aspects of paid family leave. So, you know, the adoption or the birth of a newborn is different than your parent has a bad event. So we're looking through the vagaries of that, trying to come up with something which meets these different needs and can get that bipartisan kind of support, but also we can pay for it.
Thank you. Welcome, Senator Gillibrand. Thank you so much for joining us today, and thank you for your leadership on this issue. We just got started about 45 seconds early with Senator Cassidy, hearing about your work as co-chairs of the Bipartisan Bicameral Paid Leave Working Group, which I know people are on the webinar are really excited to hear about. So if you could just tell us a little bit about that working group and how that's going, it would be great.
Right. Well, it's been an absolute joy to work with Senator Cassidy and his team. We've been working with about a handful of other senators as well, who've almost given Senator Cassidy their proxy, that if he can negotiate a good deal, they're all in. But we have a really good coalition of senators, Democrats and Republicans, which is very exciting. We also have a House bipartisan group with Stephanie Bice and Democrats with her. So we feel like this collaboration of Dems and Republicans is enough to get a real good paid leave plan underway. Senator Cassidy and I have been talking about different ways to offer affordability, because today most families do not have access to affordable quality childcare. They don't have access to a national paid leave plan. Only about 20% of workers have access to paid leave. And a lot of workers don't even have access to unpaid leave because they can't afford it. So if you can't afford to take your up to 3 months off when you've had a new child, or your business is too small and you're not eligible, there's a lot of lower wage workers in particular that are very, very challenged to get access to any type of leave at all. So we've come together with a very holistic approach. Senator Cassidy and others have written a number of pieces of legislation that affects tax policy to make it more affordable to use tax credits, child tax credits, to use other tax deductions, incentives for businesses to offer paid leave. We're going to include all of those tax provisions because they're very bipartisan. They tend to overwhelmingly help the middle class. So they are middle class tax cuts that I think will be extremely meaningful for working people. And then we're now collaborating on a new program to cover the lowest wage worker, perhaps workers up to maybe $30,000, $40,000, $50,000, depending where this ultimately ends. And it will cover all different types of leave on a gender neutral basis, parental leave, sick leave for family members, even some sick leave for yourself. And we'll assess the timelines about how many weeks for each type of leave based on affordability and what we can actually move legislation to get done this year. I'm optimistic that this will be a very holistic approach, that we will be able to get up to 12 weeks leave for lower wage workers for parental leave. And that's our goal. But we want to make sure other types of care were included, and they are included in our proposal. And so we're excited about it. We think this is going to be a framework that we can talk to our colleagues about, that we can get buy-in, that we could possibly even have hearings on. And we're very excited about the possibilities.
Wow, that's fabulous. Because one of my questions was going to be, you know, as you know, the FMLA and the state laws go beyond paid leave for new parents and cover leave for other types of situations, including own illness, care for a seriously ill family member. And so one of the questions for you both was what you see as the prospects for Congress to enact more comprehensive paid family leave rather than leave that just focuses on new parents. But it sounds like that's something that's in the works.
It's in the works. It's very, very expensive to have perfect paid leave where
Mhm.
everybody gets 12 weeks for all
Yeah.
life events.
Yeah.
That costs about $700 billion over 10 years. So finding a pay for $70 billion a year is almost impossible to do. So what we're decided is what number do we think we can find a pay for? So maybe get to $20 billion a year, a $200 billion program. So that's not going to be perfect paid leave where everybody gets 12 weeks for all life events. So we're going to make choices about what's most urgent, what's the most urgent care that people can't access elsewhere. So for example, your own physical medical leave, if we can get you 2 weeks and if we could do that across the board for all wage workers, that would be amazing. We're hoping that other states will have disability leave, that you'll have sick leave through your employer. There's other ways to get there. Parental leave seems to be something that not a lot of places cover. And for that low wage worker can make the difference of being able to bond with your baby, being able to nurse, being able to just manage being a new parent. That parental leave, we're going to try to get through a combination of just this investment plus maybe some tax provisions to try to get people up to 12 weeks. And then for care of other children, family members, loved ones, we're going to try to get to between 4 and 6 weeks. We'll see how far we can get with the budget that we're going to create for ourselves. But these are just broad outlines, but that's what we're trying to get to. And I think we can reasonably and responsibly get to a proposal. Bill and I are hoping to have our bill done by September so we could start talking about in the fall.
Wow.
That would be our goal. And we're working very hard to do that.
So-
Wow, that's just fabulous.
So, let me just compliment Senator Gillibrand. She's done a wonderful job of identifying all the dials. Now, keep in mind that we're not starting a system from scratch. We're taking a policy in which there's already a lot of pre-existing infrastructure, if you will. So, for example, if you look at people, I think the cutoff off the top of my head, it's been a while, is about $70,000 and above. People typically have paid sick leave. So we don't need to replace that which someone is getting from their employer when you're making above a certain amount of money. The real vulnerability there is for the lower wage worker. So that's a dial, right? That's a dial. And Kirsten's done a wonderful job of pointing out that, wait, here's a dial over here in terms of the number of weeks you get. And the generosity of the leave relative to your pay. So those are all dials that you can start off with the amount of money that you have to spend and work backwards as to the generosity of the range of the population which you cover.
And you can use the funds where they'll do the most good rather than using funds where you really don't need to.
Right.
Because it's already got coverage or because
correct. And we're
those
also
situations
trying
require
to
less leave. Yeah.
Yeah, and we're also trying to incentivize states to make up the difference. So this is going to be an opt-in program where a state like Bill's, for example, who don't have a statewide paid leave plan, they can decide to opt in because they want to cover their lowest wage workers. They think that's important. They want these incentives. They want people to be able to use their tax policies in ways that are favorable to themselves, so that then a state like New York can build on what we cover. So we can cover the basics through this federal program, but then if a state wants to cover employees up to $100,000, they can build on this federal program and build that themselves. So it gives the states the opportunity to see what paid leave does for their workers and does for their economy, and then decide over time, do we want to build on this? Do we want to make it more robust? And that's where Bill and I landed, that let's cover the most at need, at risk that no one else seems to be covering. Because lots of very well-paid people get access to paid leave. The lawyers and the doctors and the accountants, they tend to get university professors. They tend to get their paid leave because those employers have a lot of resources and replacing talent is very expensive. But we found that the lowest wage worker, that nobody was fighting for them, that a lot of employers thought they were easily replaced and easily changed. But what we're trying to make the case is, well, it's a lot easier not to have to replace them. It's a lot easier to have that training already completed, and then they can be on a short hiatus and can come right back. So you don't have to replace the worker. We're trying to make the case to these states that never had it, that this actually helps their bottom line. The data out of California that's now had paid leave for over 10 years, 99% employers thought it improved morale and retention. 90% said it had no negative impact on their bottom line or a positive impact on their bottom line. That type of data is so appealing. And I want other states that have never gotten to see the proof in the pudding have this chance to opt in. We're also going to have an opt-in for employers. So like if you're in a red state that doesn't decide to have a paid leave program, you, for your company, could opt in, or individuals. An individual that can't get access to her employer, that he or she can opt in. So Stephanie's working on language. Stephanie Bice is working on language for a private insurance pool that people can buy into, which I really like as a, just innovation, social innovation of ways to incentivize insurers to cover more people for more things that they need. So she's working on the language for that part of the bill.
But to demonstrate the complexity of the issue, of course, if you speak to the small employer who's got 4 employees and 3 decide to take leave, they're out of business. And so the small employer has got a definite perspective here. And it is that employer who's most likely to be adversely affected by this policy. So now you could argue, no, wait a second, you're going to be helped because you've put all this money into training. But obviously it's hard for us to make a calculation for someone who is in Shreveport, Louisiana, who's just barely has thin margins, but thinks he can keep it together. And then boom, he's got 3 people leave. So, and or a tax burden. The second thing, as regards what Congresswoman Bice is working on, the nuance there is that you don't want to have an actuarially adverse selection. The only people that sign up are the people who are going to access the program. You do that, and you're going to just have an incredible coster, which is there to be abused. And we've seen examples of that. For example, when the Affordable Care Act was first put in place, a doctor in California would say, oh yes, the person who needs artificial IVF and the sister's the donor, they jump on, they get their coverage, it costs $250,000 all in, and then they jump off the next year. So the risk pool, the robustness of the kind of support of the risk pool has to be considered. And that's why all this is difficult to come to. If it was easy, we would have already done it.
Absolutely. And that's why I think the opt-in scenario will work. I also think what Stephanie's working on, a larger insurance pool, again, will allow someone to offer this as a product that they can sustain. So we're hoping the push and the pull will work together.
Yeah, and it sounds like you're able to learn something from the states, which have a variety of different models, including insurance models, so that some of these things can be tested. And as you say, there's also a lot of research on the state policies, which, has also been very helpful. We did research, we were talking about it earlier, in New York State, and found that employers who were affected by the law said that it was had a positive effect on employee commitment and cooperation and their ease of handling absences, because they knew more formally when employees were going to be taking absences, underpaid family leave. So it actually improved their operations, similar to what had been found in California. And the employers we spoke with in New York also said that during COVID, when the need for leave went up and the use of leave went up, they became more appreciative of paid family leave because they saw how important it was to their employees, and became more supportive of the law because those who had experience with the law became more positive about it. So I think you're right that as employers get experience with the law, they're learning how to make it work. The surveys that we did were focused on employers with less than 100 employees. So we did try to focus on small and medium employers because they are really, it is the most challenging for them.
Now, did you break that down as well to those with, say, less than 10 employees or less than 20?
We didn't have any less than 10, but we had quite a few in the range of 10 to 20.
And was there any difference between those in the 10 to 20 range?
Not really, no. They were a strong majority were supportive, and only a small minority, a handful, were opposed. And
That's
we
interesting.
surveyed
Claudia
employers
Tenney,
in New York, Rhode Island, and New Jersey.
Claudia Tenney is a very capable congresswoman from upstate New York. And I remember her, this is several years ago, but she was speaking that their family business, I think into publishing business, had like 5 employees. And she posed the question, what if 3 go out at once? Now she's just kind of elaborating upon the issue. She wasn't condemning, she wasn't promoting, she was just saying, okay, let's think about this. And I do think that the smaller you are, the more vulnerable you are.
Mm.
You can conversely say the smaller you are, the better, the more you benefit if you don't lose an employee, but you actually retain.
Yep.
So I don't.
So the
have a
goal is
problem
to
with
keep
that.
their salary in the hands of the employer. So if you have this paid leave insurance plan, that worker, let's say their mother's dying, or let's say they have a new baby, or their husband got hit by a car, or whatever, they're out for a month, 2 months, whatever it is. You can then, they'll get paid through their insurance plan. You have that extra money, so you can
Right.
put that temp in. So, and temps aren't great because they're not as well trained, but it's better than losing that employee that you really have put years and years into. So you can get that emergency worker in to meet the needs of the moment. And it's possible that all your people go out at once, but it's unusual. Not everyone's getting pregnant. Not everyone's having illnesses. It would be unusual. I've had paid leave in my office, Bill, for the past 15 years. And not many people have used it, but the people who've used it all used it for different reasons. So I had a speechwriter whose mother was dying of cancer, and he took a month off to be with her. And we were able to, get other people to fill in. My general counsel, who was a woman, had 3 children under my paid leave, but it was 2 years apart. So it was fine. Like we knew how to cover that 3 months she was out because we did it 3 times. I just had someone who had to take only 2 weeks leave because both parents were gravely ill, and she had to help get them to and from their cancer treatment. So like in real life, I have 60 employees, and they all took leave at different times. And it hasn't been a burden for us. We've been able to manage without much difficulty. But I agree, if you only have 3 people, you're going to know who your 3 people are when you hire them. And you're probably going to know what their life is like faster than they do. So like, I think most small business owners are pretty knowledgeable about their 3 people. But I hope this plan that we're working on, Bill, could meet those needs too. Because I'd love small businesses to opt in, even if their states didn't opt in. I'd love them to have that resource so they could compete with the big businesses to say, we offer paid leave too. You don't have to go work at Walmart. We can do it here.
I'm with you on that.
My small mom and pop shop.
But those are the concerns being expressed by the trade associations. And so whatever policy we come up with has to address those concerns.
Yeah, you're exactly right.
Yeah. So I'm really struck that a lot of the history of the legislation in this area, ever since the passage of the FMLA, has been sort of piecemeal, sort of tinkering around the edges. As you were saying, Senator Cassidy, there's a number of different dials, and up until now, it feels like the legislation has been, let's turn this dial over here, let's turn this dial over here, let's make this correction here, let's make this correction there. It sounds like what you're working on now for the fall is a much more comprehensive piece of legislation that really tries to make all of these changes and address the different types of leave and the different populations who are left out. So, I mean, first of all, kudos for doing that, but second, I mean, how did you get there? What's been the process that's enabled you to do that? It seems quite unusual. It seems like quite a shift from where Congress has been on this issue historically.
I'll take a crack at that, then I'll finish with a compliment to Senator Gillibrand and turn it over to her. These different piecemeal efforts have to a large extent, if you added them together, cover the waterfront.
Yes.
And so Senator Sinema and I had something for newborns.
Yes.
And then let me just speak on what I'm most aware of. Senator Fisher has a tax credit that's not been much used but she was able to get that through. And Rubio and Romney had something on this with Mike Lee.
Yes.
And then I think, Kirsten, tell me, I think Herona Mazie had something as regards something more expansive. And so I think that there's and there's a theme through them all, which is how do we help folks with life situations. And so when Kirsten first got us together, she just said, can we stitch all these together? And she had kind of that global view. So again, I want to compliment her of, we are covering the waterfront. Can we stitch together?
Mm-hmm.
Now, again, the details of that are what is difficult, and paying for it is what is difficult. But nonetheless, conceptually, you can see across the spectrum.
Mm-hmm.
Cynthia Lummis, for example, is part of our working group, and she's about as fiscal hawk as you can be from Wyoming, but a mom and a grandmother,
Mm-hmm.
and understands that those life events that would call for this. So I feel comfortable that there is broad support for achieving something.
And I would just add that I've been so committed to this issue for so long. Every time I write the bill, I try to write, again, perfect paid leave, but it's not enough to just create a vision, because you need people to want to do it with you. You need Republicans that say, I like that idea. I like how you pay for it. I like how you structured it. Yeah. And I didn't have that bipartisan support for something like a Social Security program, where you buy in and your employer matches it, and it's an earned benefit. That I thought was the easiest, cleanest way to do it. Mm-hmm. But if it's not bipartisan, it's not going to become a law. Mm-hmm. So my job was to just listen to all my colleagues about what they wanted to do, what they felt like their states could do, what they felt like their caucus could do, what ways they could pay for it and not get heartburn from their constituents. And that's really important. You don't pass laws if you don't listen first. And so we listened to each other. We said, well, what are the things we can do? And, I took all their ideas and saw the real brilliance in each one, that it could address a certain thing. They tend to be quite sophisticated, so businesses are going to use it. Mm-hmm. A lot of states that are going to spend money on telling people how to do it will use it. But it's not going to be, they're all not easy. So it's going to take work. The last piece we added was this place that Bill and I thought, well, what can we do for the worker who's really going to be left out every time? Mm-hmm. And that's the new piece of this plan. It's the part that is creating something brand new that we will have to find a way to pay for it that people are okay with. But I liked that because it's showing that the government does have a responsibility to the economy to make sure the economy keeps moving, to make sure businesses can continue to thrive. And you have to be able to do that with workers working at their highest potential and not being constantly pushed out of the workforce because they don't have this safety net, which is typically what happens to a lot of female workers and a lot of low income, low paid female workers, because they are the ones at the end of the day, when COVID hit, 5 million women left the workplace because someone needed to sit with the kids while they were doing online learning. So more often than not, it's the mom who takes the moment in her life to meet that need. As a consequence, it's hard for her to move up the ladder of earning money because if she has to quit, she's going to go right back to the bottom rung. We call it the sticky floor. She never gets off it. She never becomes a middle wage worker. She's always going to be a low wage worker because she's starting and stopping so often. So we thought if we could address this group, that creates more economic growth because those women over time, and men, but women more often than not, will earn more money, keep their seniority in their companies, get to develop expertise, earn their way to the middle class, helps the economy grow. So this is a nod towards what can we do for the economy overall, and what can we do to keep these lower wage workers working, paying taxes, paying into Social Security, and earning their seniority so they can earn more over time, over their lifetime. And that's what the smaller solution piece that we're adding is. So it's exciting because it's innovative, it's new, it's something that Bill and I and other senators that we met with actually like. Even someone like J.D. Vance, when I met with him, he was like, let's make sure we can also help grandparents and other caregivers, because he knew those examples from his state. And we said, yeah, well, we're going to make sure it's for all caregivers for these life events. So you'd be surprised how many conservative Republican, fiscal conservative Republicans are interested in finding a version of this that they can be for. And that's what we're trying to build for them.
Oh, it's fabulous. So it sounds like you're very close. Are there still points to be ironed out? Or there are things you still need to learn about? It sounds like you learned a tremendous amount from this request for information that you sent out. I was really impressed at the questions that you asked and the depth of information you were looking for. So is this kind of, are you done, or is there more you need to know?
The challenge is how to pay for it. And of course I'm laughing, not to minimize it, but only because our debt deficit is exploding. And it's exploding right now in large measure because 10,000 boomers a day become eligible for Social Security and Medicare. Discretionary spending, that which Congress officially controls, has remained constant as a percent of the GDP. But the amount that's going to folks who have been promised these benefits and they're relying upon these benefits and they absolutely have to get these benefits, that is just increasing dramatically.
Yeah. So
anything you do has to be sustainable, because right now our current course is not sustainable. And so we have to be, and Kirsten, by the way, has been very innovative, but we have to come up with something that on a bipartisan basis, we as a society can pay for. Because if we can't sustain it, it is as if we had not done a program. And I don't know, Senator Gillibrand, how you would comment on that.
Yeah, no, Bill's exactly right. Finding the right way to pay for this is the biggest challenge. People don't want new spending. They don't want taxes. So we're going to look at other places that this could work. There's always fat somewhere in the system. So we're going to look at places where we can cut programs that aren't working well or are duplicative or are not needed right now as much as this. But again, if we did even this compromised version of who we cover and how we cover is $20 billion a year. It's a lot of money. So we're going to have to look very hard at different places that we do spend money and different ways to get this amount of money. I am optimistic we can find it. I sit on big committees. I sit on armed services and agriculture, and there's lots of pots of money that just sit there and keep growing. So there are ways that I think we can find bipartisan support to pay for this. And that's our job between now and September, is to find 2 or 3 pay-fors that we can then go to our colleagues and say, are you comfortable with this pay-for? But our outline of what we want to do is pretty much there. We're very happy about it, but we have to get the way to pay for it that is agreeable so that we can actually move the bill. And so that's our job for the next month and a half.
Well, it's fabulous. Congratulations to you both. It's been, 30 years since the FMLA was passed, and that, for all these years we've been trying to get there, and it sounds like you're getting there. So, congratulations to you both. And I can't think of a better example for an across the aisle presentation. So thank you both for joining today. Thank you for your leadership and for all your efforts. I can't imagine how difficult this has been and will continue to be into the fall, but it sounds like you're getting there. So
thank you. Thank you, Professor. Thank you for having us. Thank you, Senator Cassidy.
Thank you all.
God bless.
Thank you both very much. And we will stay tuned and watch with great interest. And thank you everyone for participating today. That concludes our webinar.